Welcome to this training on Mental Health Advanced Directives 101, Understanding, Supporting, and Thriving. This training is appropriate for a wide range of attendees, including people interested in having a mental health advanced directive, people who are interested in helping facilitate the completion of a mental health advanced directive, agents, care providers, first responders, crisis providers, tribal partners, certified peer specialists or peer supporters, people with lived experience, and family members of people who have mental health concerns. In this training, we are hoping to explain what a mental health advanced directive is and why it matters. We will be naming the parts of a mental health advanced directive and understanding the basic legal rules, describing how to create a mental health advanced directive and what to include, describing what a mental health advanced directive can and cannot do, and we will be learning about how people can offer support in mental health advanced directive creation and use. Now to introduce mental health advanced directives. This training is about a very helpful tool in mental health care called a mental health advanced directive, or MHAD for short. An MHAD is a legal document that lets people plan ahead for their mental health treatment. It's used when someone may not be able to speak for themselves or make decisions during a mental health crisis. Mental health conditions can sometimes cause confusion, fear, or stress that make it hard for a person to think clearly or to explain what they need. That's where an MHAD comes in. It allows a person to write down important information ahead of a potential crisis, like what treatments or medications help them, what treatments or medications they would like to avoid, who they trust to make decisions on their behalf if they are unable to make decisions themselves. The information in the MHAD can also help a person feel safer and calmer before a full crisis occurs. An MHAD does not just help the people who wrote it, it also helps the people who are trying to support the individual. Doctors, nurses, therapists, crisis workers don't always know the person that they're helping. They don't know their history and or what works best for them. And an MHAD gives clear guidance to the care team so that they can help make better decisions and respond to the individual in the most helpful way, especially during a mental health crisis or when providing help before a crisis occurs. It's important to know that a mental health advanced directive is a legal document. That means it has power. It must be taken seriously, and it must also be included in a person's medical records. Care teams are expected to follow the directions in an MHAD unless there are very specific reasons that they cannot. Having an MHAD helps people stay in control of their mental health care, even during really difficult times, because it helps make sure that others know how to provide support that feels right for the individual. It's very important to respect people's choices when it comes to mental health care, and the use of an MHAD is one way to do this. Most people are able to make smart and thoughtful decisions about their care. They usually know what helps them to feel better and what makes things worse, and who they trust to support them. It's also important to remember that people are the experts in their own lives. They know what works and what doesn't, and what can make things worse for them. Even if they are struggling in the moment, their past choices and preferences still matter, and they deserve to be respected. There may be times when mental health symptoms get stronger. During these times, a person might have a hard time thinking clearly, staying calm, or explaining what they need. These situations can be stressful for the person going through them and for their family members, friends, and care team. And this is where a tool like an MHAD can really help. An MHAD can offer clarity and direction regarding a person's preferences in situations where a person may not be able to clearly communicate them on their own. MHADs can be a powerful tool for individuals facing mental health challenges. This may include conditions like depression, bipolar disorder, schizophrenia, anxiety, any situation where a person's mental health may fluctuate over time. MHADs are also incredibly valuable for the people who struggle with substance use. Whether the substances are drugs, alcohol, or both, these sorts of challenges can sometimes lead to unpredictable or high-risk situations, especially during periods of crisis. We also want to make sure that we don't overlook the impact of trauma. People with a history of trauma, whether from abuse, violence, loss, or other deeply distressing experiences, may be more vulnerable when under stress. Trauma can shape how someone responds to a crisis, and MHADs can help ensure that their care reflects that understanding. While these are some of the most common groups who may benefit from a mental health advance directive, they're not the only ones. There are many other conditions and life circumstances that can increase the likelihood of a mental health crisis, and that's exactly where MHADs come in. MHADs provide a structured, compassionate way for individuals to express their preferences, outline their needs, and ensure their voice is heard. So when you're asked who are MHADs for, the answer is anyone who wants to be prepared, protected, and empowered in the face of mental health challenges. An MHAD is a legal document that lets someone plan ahead for their mental health care, especially in the case that there is a crisis in the future that might make it harder to make decisions or speak up for themselves. To fill out an MHAD, a person making the MHAD has to have something called capacity. So what does having capacity actually means? Having capacity means that the person is able to think clearly and make decisions about their own care at the time that they're making the MHAD. To have capacity, a person has to be able to do three things. First, they have to be able to take in facts about treatment. For example, if a doctor explains two different types of therapy or medication, the person is able to understand what each one is. Second, they need to be able to compare the risks and benefits of those treatments. This means that they can think through what might help, what might have side effects, and what feels right for them. Third, they need to be able to say what they want. This could mean choosing one treatment over another, or saying that they don't want a specific type of care based on their past experiences. It's important to know that adults are usually presumed to have capacity, so there's no need to prove capacity before making a mental health advance directive. So let's say someone named Jordan is thinking about creating an MHAD. Jordan had a mental health crisis as a young adult that resulted in his involuntary psychiatric hospitalization. There, he was diagnosed as having schizophrenia and began treatment with medications that have helped him. When he returned home from the hospital, Jordan completed an MHAD with the help of a local peer specialist. Under Washington law, it is presumed that Jordan had the capacity to complete his MHAD and that his MHAD is presumed to be valid. His diagnosis and hospitalization don't change that. If he had another crisis, providers must honor his MHAD. Washington State also allows youth ages 13 and older to make their own MHAD if they demonstrate that they're able to make an informed decision about behavioral health care. That's because in Washington, teens have the right to make some of their own choices about their mental health care. So if a 13-year-old knows what helps them during a mental health crisis, they can complete a mental health advance directive to make sure that those preferences are honored. It's important to understand how MHADs relate to safety plans. While these two tools serve different purposes, they often contain similar content and can work together to support someone's mental health journey. Both MHADs and safety plans may include personal insights like known triggers. For example, someone may note that loud environments or unexpected changes in routine tend to escalate their anxiety. Recognizing these triggers help providers and support people respond proactively. They also often include helpful interventions. A safety plan might suggest, when I feel overwhelmed, offer me noise-canceling headphones or let me take a walk outside. These same strategies can be included in an MHAD to guide what care a person needs when they aren't able to communicate their needs directly. Support people and providers are another shared element. A safety plan might list trusted individuals to call during a crisis, like a friend, peer support specialist, or therapist. In an MHAD, these names can be formally documented to help care teams know which support people might be helpful in preventing or calming a crisis. Note that care teams will need appropriate releases of information signed in order to be able to talk to general support people. So it's important to make sure those forms are available ahead of time. Some individuals choose to include parts of their safety plan directly in their MHAD. This can be especially helpful when the strategies outlined in the safety plan have proven effective over time. For instance, someone might write, "If I become suicidal, please follow the steps in my safety plan, including contacting my sponsor and removing my access to medications." But here's the key distinction. While a safety plan offers guidance and suggestions to prevent a crisis or prevent a return to using substances, the MHAD is the legal document that holds power when a person lacks the capacity to make decisions. It is the form that providers are required to follow to the fullest extent possible within the bounds of safety, legality, and availability. Together, these tools create a more complete picture of care. The safety plan helps prevent crisis. The MHAD ensures that care remains person-centered even when somebody cannot advocate for themselves. Now let's discuss the varying parts of a mental health advance directive. An MHAD usually has at minimum 2 important sections that work together to help someone stay in control of their mental health care. Let's start with the first part, the advanced instructions. This section is all about writing down the person's preferences, the things that they know from experience that help them, the things they want to avoid. This section might include medications that they consent to or ones that they refuse. Often this refusal is due to bad side effects that have occurred in the past. Types of treatment that are helpful and that they consent to, types of treatment that they know do not work or make things worse. Life responsibilities that are important, like making sure someone checks on their kids, their pets, their home, who should help with bills while they're in the hospital. It's important to note that healthcare providers are not required to address these issues, as these are responsibilities for the agent to manage. These instructions are personal and powerful. They help doctors, nurses, and crisis teams understand the person as a whole and give care in a way that works for that individual. The second part of the MHAD is called the healthcare power of attorney. This is where the person can name someone they trust to make decisions on their behalf if they are not able to do so themselves. That person is called the agent. Now, here's something really important. Choosing an agent is completely optional. A person can still fill out an MHAD with just their advanced instructions, and that document will still be valid and helpful. But having an agent can make things go more smoothly, especially in fast-moving situations where decisions need to be made quickly. Having both of these parts is not required. A person may choose to just establish an agent or decide to establish only advanced instructions and not have an agent. And both options are absolutely acceptable. Together, these two pieces make sure that the person's voice is still heard, even if they can't speak up themselves. And that can make a big difference in how safe, supported, and respected a person feels during a mental health crisis. Let's dive a little deeper into what an agent is in the context of an MHAD. An agent is someone a person chooses to be involved in their care and or to make decisions for them. The agent is like a trusted spokesperson. They help make sure that the person's voice is still heard even when that person cannot speak for themselves. The agent does not make decisions based on what they think is best. Their job is to follow the instructions and honor the preferences that the person wrote down in their MHAD. The agent can only make decisions for a person if the person has been determined to lack capacity by a professional. Once the person regains capacity, they are in charge of their own decisions again. Again, choosing an agent is optional. The person is not required to name an agent in their MHAD. If they don't want to choose an agent, they can still write care instructions that providers will follow during a crisis. However, some people feel more comfortable knowing that someone they trust is able to step in and help speak up for them. If a person does want to name an agent, it should be someone they trust deeply, someone who understands their values and will support their choices and is willing to advocate for them if things get difficult. For example, a good agent might be a close friend, a family member, a partner, or a peer support worker, someone who knows the person's history and truly wants what's best for them based on the person's own wishes. The agent must be willing and able to follow the directions in the MHAD. That includes what treatments the person does or does not want, who they want involved in their care, what helps them most in a crisis, and any other instructions that they've written. Where there is a question about what's written in the MHAD or where a decision isn't covered specifically in the MHAD, The agent should do what they think the person would want. To officially name an agent, that person must include them in the power of attorney form for mental health care. This is usually included at the end of the MHAD form. When someone chooses to appoint an agent in their MHAD, there are a few important steps that need to be followed. First, the agent must be notified in writing that they have been selected. This is a legal requirement that ensures the agent is aware of their roles and responsibilities. But even before that written notice goes out, it's best practice to have a conversation with the person you are considering. Make sure that they understand what it means to be an agent, that they're comfortable with the responsibility, and that they consent to take on the role. This helps avoid confusion or reluctance later on. Now, if an agent decides they no longer want to serve in that role, they must also provide written notice to the person who appointed them, and also to any known providers. This ensures that everyone involved in the person's care is aware of the change and can adjust accordingly. So clear communication and documentation are key, both when appointing an agent and if that agent steps down. In the next few slides, we will walk through the kinds of information a person can include in their mental health advance directive. For example, they can describe their mental health conditions in their own words, not just a diagnosis, but how it affects them day to day and what treatments have worked best for them in the past. This helps providers respond with care that is informed and personalized. They can also outline what helps during a crisis, give consent for specific treatments, including hospitalization or medications, or refuse ones that have caused harm or discomfort in the past. Beyond medical care, MHADs can include support systems, who to call, which providers should be involved, which tribal health or community providers should be consulted. They can also include traditional, cultural, or spiritual practices that bring comfort and healing. This ensures that care is not only clinically sound, but that it is culturally grounded and community connected. When filling out an MHAD, it's really important to include information about a person's current health and medical needs. This helps doctors and crisis teams take better care of somebody during a mental health emergency. Let's go through some of the key things that people might include. First, they might include physical health problems. If someone has a health condition like asthma, diabetes, or a heart problem, that really needs to be known ahead of time. That way they don't get medication that could make things worse or miss care that could help keep them safe. We also want to include mental health or substance use conditions. It helps to know what diagnoses a person already has, what types of treatment they prefer, what has worked or not worked for them in the past. This allows the care team to make better, faster decisions. Current medications should also be listed. If a person takes certain medications every day, whether for physical health, mental health, substance use treatment, those medicines should be listed. This helps prevent dangerous reactions or withdrawal symptoms and make sure that the person stays on track with their treatment. We want to make sure to include any gender-affirming care and medicines. For people that receive care related to their gender identity, like hormone therapy, it's important to include this in their mental health advance directive. These treatments are essential to their overall health and well-being, and they should continue even during a crisis. Care related to pregnancy is also important. If someone is pregnant and might be pregnant and has needs related to that care, this should be noted. We also want to include anything else that's important for a person's care. Everyone is different, and a person may have cultural, spiritual, or personal needs that matter during treatment. The MHAD is a chance to write down all of this so that nothing important gets missed. So as an example, someone here might list, I have post-traumatic stress disorder and anxiety. Talk therapy, deep breathing exercises help me to stay grounded. It's also important to include information about who helps support the individual and what types of accessibility needs they may have. This helps to make sure that during a mental health crisis, the right people are contacted and any important accommodations are provided. Here is where a person can list the name and contact number of their mental health agent and outline their role and responsibility. This will help providers know who to contact if a crisis occurs. It's also helpful to include the names and phone numbers of other supportive people like family members, friends, case managers, or peer supporters. These contacts can be a big part of helping that person feel safe and supported while they recover. This is especially helpful in the case that the agent is not immediately available. That way, there are some backup supports in place who might be able to help the situation feel calm more quickly. It's important to remember that the appropriate release of information forms have to be signed for the care teams to be able to contact anyone other than the agent. In some instances, the agent themselves is who may be the one doing this outreach to get these forms signed. Next, the Mental Health Advance Directive should list the languages the person speaks and whether or not they need help understanding medical information in that language. If someone needs an interpreter or written information in a different language, the care team needs to know that as soon as possible. The MHAD should also include any supports needed because of a disability. This might include help with seeing, hearing, moving around, reading documents, or understanding information. Including this type of information in the MHAD makes sure that the person gets fair and respectful treatment no matter what their needs are. Lastly, it's also important to include information about any allergies or dietary needs that the person has so that during treatment, providers can make sure the person is safe. When someone is in a mental health crisis, small things can make a big difference in how they feel. This is why an MHAD is a great place to include specific crisis preferences, including personal details that help others respond in the most supportive way possible. For example, a person can list ways that help them feel calm when they are upset. This could be listening to music, having a quiet space, talking to a trusted person, or even holding a favorite item. When care teams know what works ahead of time, they can use these tools right away. They might say, if I'm in a crisis, please give me a quiet room with low lighting. Or please call my best friend Maria. Hearing her voice helps me calm down. The MHAD can also explain how much a personal space a person needs. Some people feel safer when others stay back a few feet, while others might want someone close by. Making this clear in advance can help avoid misunderstandings or added stress. It can also be helpful to say how much eye contact feels okay. For some people, eye contact shows connection and respect. For others, it can feel overwhelming or uncomfortable. Sharing this helps staff interact in a way that feels safe and respectful. The MHAD should also include who should be called during a crisis. This might be a family member, friend, peer supporter, or case manager, someone who knows the person well and can offer comfort or help make decisions. We also want to write down the preferred name the person wants to be called. Using the correct name shows respect and helps the person feel seen and valued, especially during vulnerable moments. Any supports or preferences that a person has related to their culture should also be included so that the care team can honor that person's cultural needs and preferences and provide care in a manner that is most aligned with that person's identity. Including these personal preferences in a mental health advance directive helps make sure that care feels tailored to the individual, which can build trust and help de-escalate some situations more effectively. A big part of creating an MHAD is making sure it includes the person's preferences about treatment. Everyone responds to care differently, so it's important to write down what works and what doesn't before a crisis happens. The MHAD can include a list of medications that help and include an advanced consent for these. These might be medicines that are already known to improve mood, reduce anxiety, help the person sleep. Listing them helps make sure that the person gets the same support if they're ever in a crisis and unable to ask for it. It's also just as important to include refusal of medications that don't work or are not wanted, along with a short explanation of why. Maybe the medicine caused bad side effects or just didn't help. This can prevent unnecessary or harmful treatment from being repeated. They might write, "Please do not give me Ativan, it caused me memory loss." Or, "Do not place me in restraints unless it's an absolute last resort." People can also write down what types of therapy help them feel better, like talking to a counselor, doing art therapy, using coping skills they've learned in group sessions. These are great to include because they show what has worked in the past. On the other hand, a person can list types of therapy that have not helped them or even made them feel worse. If something was too stressful or triggering, it's helpful for the care team to know that in advance. For example, some people struggle to feel safe in group therapy settings. That sort of information is important to document so the care team is aware of which treatment options may not be a fit for that person. The MHAD should also include traditional, cultural, or spiritual practices that the person prefers to ensure that the treatment incorporates approaches that the person finds supportive and respectful. For example, a person may prefer to have a care provider of the same gender, or they may want a faith or tribal leader to be contacted. These considerations are very important for the delivery of trauma-informed care. The MHAD can also name doctors, therapists, or hospitals that the person trusts or wants to avoid, and this is where a person can document consent for certain treatments as well. They may write, "I agree to take Zoloft if I'm struggling with depression," or "I prefer to receive care at Evergreen Mental Health Center." They could also say something like, "Please involve Dr. Patel, my psychiatrist, in any treatment planning," or "Contact my therapist, Jamie Owens, for background on my trauma history." By sharing these treatment preferences, the MHAD helps ensure that the person receives care that's effective, respectful, and based on their own lived experiences. When someone's going through a mental health crisis, it's easy for important parts of their life to get interrupted. That's why an MHAD can include information about the person's daily responsibilities and routines so that their recovery is smoother and that they can get back to their life more easily. The full care team should have access to the MHAD so that the case management providers can help arrange recovery and transition supports for that person. The MHAD can include important things about the person's life in general. This may be details about their family, pets, hobbies, or spiritual practices, anything that matters to them and helps define who they are. Knowing what brings meaning to someone's life helps the care team support them in a way that feels personal and respectful. It can also be helpful to include information about where the person lives. For example, do they live alone, with family, or in a group setting? This kind of information can help avoid stress or problems at home during recovery. Next, a person can add details about their job, such as where they work, what they do, and whether somebody should be contacted about their absence. Including this in the MHAD can help protect their job and make the transition back to work easier once they're feeling better. For example, a person may write, "Please contact my supervisor, Maria, and tell her that I am in the hospital and how long I will be here. Do not share the reason why I am in the hospital. Let her know I will contact her as soon as I can with a return to work date." Finally, if a person's in school or any sort of learning program, the MHAD can mention where they go, what they're studying, and any upcoming due dates or supports they may need. This is especially helpful for anyone working toward a degree or certification who might need to have their school notified of their absence. Treatment providers themselves may not be the appropriate people to manage these case management specific tasks. However, the full care team should have access to the MHAD so the instructions can be incorporated into case management and transition planning efforts. When someone's going through a mental health crisis, it's also important to plan for all of the life responsibilities the person may have to make sure they are taken care of while the person is getting help. Often it's the agent who helps to make sure that these items are addressed. If there is no agent, case managers on the care team might be able to help. One important part is making sure that children are taken care of. The MHAD can list who should watch the children, what their routines are, and any special medical or school needs. This helps the kids stay safe and supported while the parent focuses on getting better. Pets also need care. For many people, pets are like family. The MHAD can name someone to take care of feeding, walking, and giving medications, so the person does not have to worry about their pets while they're in treatment. It's also important to list any other dependents that may rely on the person having a crisis. This includes any family members or friends for which the person has caretaking responsibility. The MHAD can also include bills that need to be paid, like rent, electricity, phone service, medication costs, and explain how to pay them or who is trusted to help manage that. It's also important to include whether the person is involved in the legal system, such as being on probation, parole, or part of a court program. If someone has legal responsibilities, it's important that the right people are notified right away if there's a crisis or a hospitalization, so that they do not have to navigate any sort of negative consequences associated with their hospitalization. The MHAD can include the name and phone number of the person's probation officer, court contact, and instructions about what needs to be shared. By including all of these things in an MHAD, the person is protecting their home, family, pets, finances, and legal standing so that when they're ready to return, their life is still intact and waiting for them. When discussing MHADs, it's critical to recognize the unique considerations for American Indian and Alaskan Native communities, especially here in Washington State, which is home to one of the largest American Indian and Alaska Native communities in the country. MHADs are designed to center the individual's voice in their mental health care. For tribal members, that voice is often deeply rooted in community, culture, and tribal sovereignty. So when creating and using MHADs, work to prioritize cultural responsiveness as a foundational principle. Let's break this down into several key areas. First is tribal sovereignty. Tribal nations are sovereign governments with their own laws, healthcare systems, and protocols. That means that MHADs must be developed and implemented in ways that respect tribal authority. For example, if a tribal member receives care on tribal lands or through tribal health clinics, their care should be approached in relation to that jurisdiction. Coordination between state systems and tribal entities is essential to ensure that these directives are valid, actionable, and culturally appropriate. Next is identification of tribal affiliation and connection to Indian healthcare providers. A person can use the MHAD form to identify if they are affiliated with a tribe and/or receive care through tribal healthcare providers, known as Indian healthcare providers. This information can help connect individuals with their tribal community and healthcare providers supporting their care. Next is connections to tribal cultural teachers or community providers. Mental health care is not just clinical, it's also relational. Many tribal individuals rely on extended family, elders, spiritual leaders, and community members for support. MHADs should reflect these preferences by naming who the person wants involved in their care. This might include a tribal behavioral health provider or a cultural practitioner. Including these voices ensures that care is grounded in relationships that foster healing. Next is identification of traditional, cultural, or spiritual practices. Western mental health models often focus on diagnosis and medication, but in many tribal communities, healing is holistic. It may involve ceremony, connection to the land, storytelling, or traditional medicine. MHADs should allow individuals to include these practices as part of their treatment plan. For example, someone might request access to a tribal healer during a crisis. Incorporating tribal-specific considerations into MHADs can honor the sovereignty, dignity, and cultural identity of tribal individuals. This helps move from a one-size-fits-all approach to one that truly meets people where they are. Now let's talk about legal considerations. Now that we've talked about what an MHAD is, let's look at another really important question. When does an MHAD become active so it helps guide a person's care? When someone fills out an MHAD, they get to choose when it becomes active. That means they get to decide the point at which the MHAD starts guiding their care, and if they've picked an agent, when that agent can begin helping with decisions. There are three main options for when an MHAD can become active. Option 1 is when the MHAD is signed. This first option is for the MHAD to go to effect right away as soon as it's signed by the person and either a notary public or two adult witnesses. This doesn't mean the person is giving up control. They still have capacity and they are still in charge of their care, and they can make decisions just like before. If they've chosen an agent, this option allows that agent to be involved right away. The agent can talk with the person's mental health or medical providers, review records like treatment history or medication, or help the person think through choices and give support. This might be a good option for someone who wants help navigating care now, not just during a crisis. They might not be in crisis, but they want their agent to have access to support them in planning, attending appointments, or staying on track. This can be helpful. The agent is actively informed of the person's care and has up-to-date detailed information if a crisis occurs. As an example, someone may say, I want my mom to be able to talk with my therapist right now and help me plan my care even though I'm doing okay. Even if a person doesn't need help now, this option can help reduce barriers for the agent's authority when the person is in crisis, since it does not rely on a healthcare provider to determine if a person's incapacitated. The second option is when a person is found to be incapacitated. The second option is for the MHAD to go into effect only if and when a healthcare provider says the person no longer has capacity. This means a doctor or mental health professional would need to evaluate the person and determine that for now, they are not able to make informed decisions about their care. At that point, two things happen. The instruction in the MHAD must be followed by the care team, and if there is an agent named, their legal authority begins. They can now make decisions, speak for the person, and help make sure the person gets the care that they wanted in their MHAD. Before that moment, while the person still has capacity, the agent cannot step in. They do not have the power to act or make decisions until the provider makes that formal determination. As an example, in the second option, a person might say, if I'm in a psychiatric crisis and have been deemed incapacitated, I want my MHAD to activate and my agent to take over only then. This option gives some people comfort because they can keep full control of their care until they truly cannot speak for themselves. The third option is that the MHAD goes into effect when certain events or conditions happen. This gives people even more flexibility. They might say in their MHAD, my MHAD should go into effect when certain things start happening, and then describe those things. These are trigger events that can be anything that the person knows are signs that they're heading into a crisis or starting to struggle. For example, they might say, when I stop sleeping for more than 2 nights, if I stop taking my medication and start isolating from everyone, when I become verbally aggressive toward family. But this option requires something else too. The person must say who gets to decide when those signs are happening. It could be a family member, a friend, a therapist, or somebody else they trust. So they might put, if my sister sees that I've been hearing voices and not taking my medication, I want her to let my provider know that it's time for my MHAD to be used. This option works well for people that may not want to wait until they're formally declared incapacitated and want to catch the crisis earlier before things get too overwhelming. So, which option is best? There is no right or wrong answer. It is all about what feels right for the person and what helps them feel most supported and safe. Some people want their MHAD to be active right away so their agent can be involved as a support partner from day one. Others want to wait until they truly lose the ability to speak for themselves. And some people know the early warning signs of a crisis and want their MHAD to activate when those signs start to show up. No matter which option they pick, the most important thing is that the person has a plan that reflects their wishes and that providers and supporters follow it. Under current legislation, providers are required to honor MHADs to the fullest extent possible. That phrase, fullest extent possible, is key. It means that, in general, a person's documented preferences for their mental health treatment must be respected and implemented. However, there are specific exceptions built into the law. These exceptions are safeguards. They exist to ensure that care remains ethical, legal, and safe for everyone involved. Here are the 4 conditions under which a provider may decline to follow an MHAD. First is related to standard of care. If following the directive would violate the accepted standard of care, meaning it would go against what is professionally recognized as safe and effective treatment, then the provider is not obligated to comply. The second is related to legal boundaries. If the requested treatment would violate the law, the provider must refrain. No directive can override the legal statutes. Next is the availability of treatment. If that treatment specified in the MHAD simply is not available, whether due to facility limitations, staffing, or resources, the provider cannot be expected to deliver it. Lastly is emergency situations. In the cases of emergency, if following the MHAD would endanger the life or health of the individual or others, the provider has the authority to act outside the directive to protect safety. It's important to note that the Washington Code makes it clear that Washington legislature intends that a failure to follow these guidelines can be grounds for a civil claim and for disciplinary action in regard to the provider's license. So while MHADs are powerful tools for self-advocacy and planning, it's important to understand that they operate within a framework of clinical judgment, legal compliance, and real-world feasibility. Ultimately, the goal is to balance respect for the individual, autonomy, and the responsibility to provide safe, lawful, and effective care. It's also important to talk about what happens when a mental health crisis escalates to the point of hospitalization under the Involuntary Treatment Act. In these situations, the individual's MHAD may not be followed. This is because the legal framework of the Involuntary Treatment Act can override the preferences laid out in the MHAD. Specifically, if a provider determines that the preferences in the MHAD are inconsistent with the purposes of the commitment or with any related court orders, the MHAD is considered invalid for that period of treatment. That means the provider is not legally bound to follow it. However, even when the MHAD is deemed invalid, it still holds value. Providers can use it to advise treatment decisions, offering insights into the individual's preferences, history, and what has worked for them in the past. Ideally, the MHAD should be used before a crisis reaches this level of voluntary hospitalization. When implemented early, the MHAD can help de-escalate a situation and guide care in a way that aligns with the person's wishes, potentially preventing the need for Involuntary Treatment Act intervention altogether. It's also important to note that an MHAD does not give an agent the power to admit a person into a hospital over their objection, unless it is consented to in the MHAD. Only a judge or certain laws can decide when someone has to be admitted against their will. The agent can help speak on the person's behalf, but they cannot make that kind of legal decision alone. Note that in Washington state, a person can give the agent the power to admit them to a psychiatric hospital when they lack capacity, even if they are refusing. To do this, the person has to have an evaluation and meet medical necessity requirements for admission. Creating an MHAD is about giving people a structured way to make their voices heard and ensure their care reflects their values and experiences. Let's walk through the steps to creating an MHAD together. The first step is simply making the decision to create an MHAD. That choice itself is powerful. It's a way of saying, I want to take control of my future care and make sure my preferences are honored. It's similar to a living will in physical health care, but here it focuses on mental health. It's proactive and empowering, especially for people who may have experienced times where their voice felt overlooked in the past. Second, it's important to remember that creating an MHAD does not have to happen all at once. In fact, it often works best when completion is spread across a few sessions. Taking it slowly allows the person to reflect on what has been helpful in the past, what has not, and what kinds of support they want if they are in a crisis. If the person does not want to work on it alone, trusted supporters, whether that's a peer specialist, family member, or a behavioral health provider, can guide the process, ask thoughtful questions, and help ensure the person's wishes are written clearly and respectfully. The third step is to make the document official by getting the appropriate signatures and having it notarized as applicable. This is discussed on a later slide. Next, share the MHAD with others. A directive is only useful if people know it exists and can access it in a crisis. That means giving copies to treatment team members like doctors, case managers, and therapists, as well as to supportive friends or family. It's also a good practice to keep extra copies in places where they can be found quickly, like in a personal file, electronically, or a wallet card that explains where to find the person's MHAD. The MHAD should be treated as a living document. Life circumstances, medications, and providers change, and so do preferences. For example, someone may discover a new medication that works well, or they may experience a living situation that changes what supports they need. Positive life changes like moving into independent housing or reconnecting with family can also influence care preferences. It's good practice to review and update the MHAD regularly, such as during annual treatment planning. Once updates are made, it's essential to redistribute the most recent version. Outdated directives can cause confusion, especially in fast-moving crisis situations. Encourage people to create a checklist of who has copies so that they can make sure everyone receives the new version. It's also wise to mark older versions out as void to avoid any mix-ups. Many people find it helpful to fill out an MHAD with the support of someone they trust, such as a professional or a loved one. Creating an MHAD is an important process, and having someone there to talk through all the details can make it clearer and easier. Some states or agencies have providers who have gone through a special training to help people complete MHADs. These providers can be great helpers in navigating the completion of the form. However, a person can choose anyone that they trust to help them talk through and/or complete the MHAD, including certified peers, who are people who have lived through similar experiences and can help provide support or understanding. Mental health helpers or advocates. individuals who are trained to guide others through the process and make sure that their rights are respected, family members or friends, trusted relatives who know the person well and can help reflect their values and preferences, staff at a clinic or program, professionals who can help offer technical help or make sure that the form is filled out correctly. As a reminder, people can create and complete an MHAD at any time that they are thinking clearly and able to understand what's happening. It's essential to remember one guiding principle. MHADs are about the person receiving care, not anyone else. The purpose of an MHAD is to capture the individual's voice, values, and preferences. That means the facilitator helping to create the MHAD and the agent appointed to act on it must stay focused on what the person wants, not what others or themselves think is best. So let's look at a few examples to help make this real. Suppose someone says they do not want to receive services from a particular agency because they've had negative experiences there. Even if the facilitator works for that agency, they should never pressure the person to include that in their MHAD. The facilitator's role is to support, not to steer the person's choices. Or imagine that the agent personally believes that medication is the best approach, but the MHAD clearly states the person prefers therapy and traditional healing practices. The agent must follow the MHAD and honor that preference, even if it differs from their own opinion. Another example, let's say the MHAD includes a request for a quiet space and limited visitors during a crisis. The agent should not override that by inviting family members or placing the person in a noisy environment just because they think it would be comforting. The directive is there for a reason. It reflects what the person knows works best for them. Now, there may be situations in which the MHAD does not address a specific issue. In those cases, the agent must act in the person's best interest. But even then, it's not about guessing. It's about making decisions that align with the person's known values, cultural background, and past choices. For example, if the MHAD does not mention a preferred provider, but that person has consistently chosen care through a tribal health clinic, the agent should consider involving that clinic rather than defaulting to a mainstream provider. To make sure that an MHAD is legally valid in Washington, there are a few specific requirements that must be met. Let's go through these step by step. First, the MHAD must be in writing. Verbal statements or agreements are not enough for a legal document, so the information has to be written down. Second, the document must use clear words that show the person's intent to create a directive. So somewhere in that document, it must be clearly stated that the document is intended to create a directive for the individual. Third, the directive has to state whether the person wants to keep the power or revoke the MHAD if they are found to be incapacitated, or whether they choose to give up that power while incapacitated. This is a very important legal distinction. It must be spelled out clearly in the document. Fourth, the MHAD must be dated and signed by the individual creating it. Without a signature and a date, it will not be recognized as valid. Finally, the directive must also be signed by either a notary public, which is often the best and most straightforward option since it provides clear proof that the document is authentic, or two qualified adult witnesses. If witnesses are used, there are a couple of restrictions. These adults cannot be the person's healthcare agent, their treating provider, the owner or staff of a facility where they live, a relative or partner, someone who is incapacitated, or anyone who might financially benefit from their treatment. This rule helps protect against conflicts of interest and ensures that the person's wishes are respected fairly. In Washington State, there are already several template forms available to help people complete an MHAD. The good news is that MHADs do not need to be created from scratch. Any of the available forms can be used as long as it meets the basic legal requirements outlined in the checklist reviewed earlier. These templates are designed to make the process easier and more accessible. They guide individuals step by step through the decisions they'll need to make, such as treatment preferences, medications, and who they'd like involved in their care. To find these forms, access the Washington Healthcare Authority's Mental Health Advanced Directive webpage. It's a trusted official source where you will find downloadable documents that people can fill out and adapt to their own needs. Now let's talk about revoking or canceling an MHAD. In Washington, a person can revoke their MHAD at any time until they are found to be incapacitated. Once a person is found to be incapacitated, that person cannot change their mind and cancel their MHAD. Once the person regains capacity, the person regains the authority to revoke their MHAD. However, Washington law allows a person to write into their MHAD that they are keeping the right to revoke their MHAD even when they are incapacitated. If they do that, they can revoke their MHAD at any time, even when incapacitated. So the MHAD should clearly set out the person's wishes regarding revocation. People going through a mental health crisis sometimes realize that when they are incapacitated, they make decisions that negatively impact their mental health. For example, they may refuse treatments that they had earlier said they wanted in their MHAD. They may also object to the agent they chose to make decisions for them. That's why the MHAD stays in effect during the time that they are unable to make decisions, so that they can still get the care they planned for, even when they are feeling afraid or struggling to think clearly. However, if someone wants to keep the right to cancel their MHAD, even while they are in crisis or incapacitated, they can. They just must clearly say this in the MHAD. Another key point is that revocation must be in writing. Verbal requests do not count, and it is not effective until the healthcare provider is actually informed about it. In other words, even if a person writes a revocation, it does not take effect until their treatment team knows about it. So revoking an MHAD is possible, but it has to be clear, in writing, and shared with providers to make sure the change is recognized and respected. Here are a few final thoughts. In order to support the use of MHADs, note that if a person has not included an MHAD yet and not created an MHAD yet, it's a good time to consider starting one. Planning ahead before a crisis happens helps protect a person's voice and ensures that their care matches their preferences. Friends or family members can also be part of the conversation. It's important to ask loved ones if they already have an MHAD. Sometimes people create one and forget to share it, or they may have questions about how to get started. If someone already has one, it should be reviewed regularly to make sure it's still up to date. If medications have changed, new providers have been added, or life circumstances are different, the MHAD might need some updates. Anyone living with mental health needs, especially those who have experienced a crisis before, should be encouraged to start a conversation about creating an MHAD. It's a simple, powerful tool that gives them more control and peace of mind. Finally, providers play an important role too. Mental health professionals, peer supporters, healthcare teams should actively encourage the use of MHADs with the people that they serve. They can also model this by talking with their own teams about how to recognize and respect MHADs during treatment. To learn more, please explore the additional training topics listed below, all related to the development and implementation of mental health advanced directives. Here are some important crisis support numbers, including the 988 Suicide and Crisis Hotlines, Native and Strong Lifeline, and the Native Resource Hub. Additional resources are listed on this slide and in the printout related to many resources that are connected to Washington law, mental health resources, and resources for creating mental health advanced directives. If you have questions, please contact the HCA through the HCA MHAD webpage. Thank you.